root causes of chronic disease. And this is an important subject because we know that quite often medicine is looking for disease. In other words, we're just looking at the range and whether a person is either going to be within this laboratory range. And that is, for the most part, way too late to pick up and to be preventative for these chronic diseases. So that is our discussion today, is what are these root causes of chronic disease that holistic functional medicine really focuses in on and works to be preventative. We empower our patients to be proactive in their health and not to wait for these chronic diseases to sneak up on them. They call them the silent killer for a reason: heart disease, diabetes. They take years at times, sometimes months, depending on lifestyle and other factors. It's not just about genetics. Genetics is really just a part of the picture. It's all about all these additional inputs from the environment, lifestyle, ways of eating, also the how a person sleeps, the quality of their social life, how stressed out they are with their work, and many factors are involved with chemicals, the drinking water. Is so much out there. It is true, but the main thing to know is that things can be done. A person can be proactive. They can be preventative in the choices that they make. So, what are some of these root causes of chronic disease? Well, one of the main factors that we work on are blood sugars and insulin resistance. So it's so important to know both of those pieces of the puzzle. And it's not only about measuring an average of blood sugars over 3 months, and that's known as the A1C. It's about being more proactive, more preventative by knowing if there are elevated levels of insulin as compared to the blood sugars. The name of the game is keeping the blood sugar stable and not having these roller coasters of ups and downs of blood sugar. So, what we do is we look at the relationship of blood sugar, cortisol, which is our stress hormone, and yes, exercise and perception of stress. So even if it's not an actual stressful event, but a person is just sitting in traffic, for example, or waiting for something that creates nervousness or anxiety, that is actually another form of stress. And all of that plays a role in cortisol and can raise blood sugars. So you got to look at that whole dynamic. The other factors that we look very much in on are vitamins and nutrients, because it's not just being deficient, it's optimizing your vitamins and nutrients and minerals. And that's what's so important, is to not just wait for the numbers on the blood test to look like it is deficient, it's below the level on the range. We want to make sure it's at the optimal number. And for example, we want to make sure vitamin D, magnesium, zinc, selenium, these very important nutrients are being measured and are at the optimal numbers. And we're not just going to be satisfied with just serum levels of these vitamins and minerals. We're going to use the best ways that we know to get accurate measurements of how the cells are using these vitamins. That's functional medicine. It's not just the plain level of these vitamins and minerals and nutrients. It's how the body is using these vitamins, nutrients, and minerals. And you can do that by functional types of testing to look at enzymes in the body, different systems that have byproducts that you can measure. And when these byproducts are either low or high, that could show you whether the body is not at their optimal amount for particular nutrients, such as vitamin B12, folate, and other B vitamins, for example, and zinc. Zinc has an enzyme such as alkaline phosphatase, which is zinc is used in that enzyme. So when we see that the alkaline phosphatase is particularly low, we're going to look at zinc levels for that person. So vitamins, minerals, nutrient deficiencies or insufficiency is the key, and not having them at optimized numbers, optimized levels is an important factor in aging well. Now another factor that we look in on are essential fats. Good fats are the key to good health. So we make sure we measure omega-3 and omega-6. Those are the good fats, and the so-called inflammatory fats that we want to be in a certain ratio, a certain balance. That's another factor in aging well. Another one is methylation. That's how our body uses nutrients such as B12, folate, choline, vitamin B2, which is known as riboflavin, and other nutrients such as SAMe in this process known as methylation, which helps us with detoxification. It helps us with our antioxidants. It helps our DNA reproduce and make new cells appropriately and effectively. It helps with our neurotransmitters so we can feel good and feel balanced. It helps with our hormones, our elimination and breaking down of hormones is all based on this system called methylation. So these vitamins and nutrients are key players in that system that we really check in and optimize. The other system we optimize is our detoxification, which occurs mainly in our liver. There are different phases that we want to optimize, and we can see these different phases in the liver, such as methylation, which I just discussed, or glucuronidation, and glutathione. These are all systems and pathways in the liver that need to be optimized so we can remove toxins, remove excessive hormones, and be able to really process through the daily living and the amount of toxins and chemicals we're exposed to. So these are just some of the ways that in functional medicine, holistic medicine, we're looking at root causes. We can't leave out the gut. The gut microbiome is in so many studies and research. But what's so important is not just fixing the gut as in doing protocols or detox fasting programs. It's really being scientific and evidence-based. Are there certain keystone species like beneficial Akkermansia or fecal bacterium that produce these very beneficial metabolites known as butyrate? Do they also are they in sufficient numbers? Are lactobacillus or bifidus? They all produce and help with neurotransmitters. Again, our feel good and the gut brain connection. We want to make sure that there's not an overgrowth of these so-called neutral or commensurate or opportunistic bacteria that can, when they're overgrown, they can create inflammation. The die off of these bacteria, these are mostly gram-negative bacteria, create inflammation. They're known as lipopolysaccharides. So it is something very real in medicine that is discussed in many research papers. And we want to measure then, if it's so important in the research, how do you measure then that we have an overgrowth of these neutral, commensurate, opportunistic bacteria that can be very inflammatory and they can stimulate our immune system over our immune system can overreact. That's what's so important to some of these very important bacteria that we know can be associated with autoimmunity. Those are bacteria such as Citrobacter, Prevotella, Proteus. We know Klebsiella can be associated with different types of autoimmune conditions. Very important. We also want to make sure there's no candida overgrowth and parasite overgrowth because they can cause skin issues, other gut issues, and again, absorption and use of nutrients and vitamins. We also want to make sure that this intestinal health is optimized. Is there sufficient hydrochloric acid to digest proteins and minerals? Is there sufficient enzymes to break down the protein and fats? Are we breaking down fat so we can absorb the fat soluble vitamins such as vitamin A, D, E, and K? These are all very essential to really find out and optimize so that we can age well and prevent these chronic diseases. So everyone, leave a comment below if you have any questions. Please let me know what you think on the replay. Just put pound replay. Let me know what you any comments or questions. And everyone have a healthy, happy day.